you're going to always be learning. Okay. So another thing is, and that's even just as an expert nurse or a more experienced nurse or someone that's been a nurse or in the healthcare field for 5+ years of nursing experience, we learn every single day. Every single day you're learning something new. There's always new medical studies that are coming out of better ways to treat certain diseases and stuff. And there's going to be newer protocols. You're always going to be learning. There's always going to be a new medication that's going to be on the market, right? You're going to have those reps coming in telling you about a new heart medication. We're always learning. But as a new grad in particular, you're learning even more so than everyone because you're still trying to learn the foundation of being a nurse, of exactly kind of your workflow, exactly how you're going to prioritize your patients, the medications you're giving your patients, why you're giving the medications, how to get these orders from the physician, how to talk to physicians, you learn at such an exponential rate. And I tell this to people, especially from my own experience whenever I was a new grad and it was during COVID time. So of course I had to learn on the fly. Unfortunately for myself, it was really, really hard to really turn to a lot of my coworkers just because nobody knew how to treat COVID at the time. We were learning every day about a different protocol. Every day it seemed like we were giving a different med or adding a med or proning patients when we started learning that this was really helping patients, or it was different. And every time I wasn't sure about what I was supposed to be doing with my patient, unfortunately, none of the other nurses knew what was working, what wasn't working. They pretty much were like, Kristen, whatever you think is going to work, you do you. So I felt like learning for myself. I felt like the first year, especially as a new grad, I felt like I was a nurse for 3 years because I felt like my learning curve exponentially grew just because I had to learn, right? I had to learn on my own and use my critical thinking and really try to hone in on everything. And it can be hard. And that's why I mentioned about making sure you guys have that support. Bounce some ideas off of other people, talk to other nurses and how they dealt with stuff. It is important to have that support, but you're always going to be learning. As a new grad, you're going to be learning every single day. You're going to be learning and constantly learning. And that's a good thing. Because especially in the beginning when you're brand new and you're just trying to get your feet wet and trying to hone in on your skills and everything else, you're going to get a groove. You're going to kind of get an idea of how things are going to work or how your day is going to work or your night, especially if you're like a night shift nurse like I was. You're going to get an idea of how all that's going to be. But just know, learning, keep wanting to be that person, especially if it's a skill you haven't seen done or you hadn't done yet and there's another nurse on your unit that's going to be doing it for a patient. Ask them if you can do it. And then they can be there and help you so that you can learn, you can do it, you can practice. That is very important. Try to get as much experience as you can. So, and just like kind of like when you were a nursing student, actually, it's kind of the same way. So if you got to see a skill or maybe just listen in on something, see anything, right? Just to get that learning experience while you see it. Same thing as a nurse. So if you want to do it, do it. Make sure you guys take as much time to learn and execute a lot of these skills if you're able to. It's very important. So learning, very important. Hey everyone, if you enjoyed watching that clip and you want to see the full video to it, make sure you guys click the box here. If you enjoy watching these kind of videos and you want to see more videos from the Nurse Kristen YouTube for pre-nursing, nursing student, new grad nurses, make sure you guys hit the subscribe button over here.